Yeah, at ASCO we presented the first results and biomarker of the SURE-01 trial. This study is about patients with muscle-invasive bladder cancer, which is a challenging disease. For many years, the standard treatment for these patients was represented by cisplatin-based neoadjuvant chemotherapy, followed by radical cystectomy. But around half patients, they are not eligible for cisplatin and receive a radical cystectomy without neoadjuvant chemotherapy. For this patient, the prognosis is dismal because there is a high rate of relapse, and so the overall survival is short. With the SURE-01 trial, we designed an alternative neoadjuvant treatment, also for cisplatin ineligible or refusing patients, using Sacituzumab govitecan, which is a new antibody-drug conjugate targeting TROP2. Yeah, this was a single-center phase 2 trial for patients with muscle-invasive bladder cancer, so patients with CT2, 2T4, and 0 urothelial carcinoma, treated with 4 cycles of neoadjuvant Sacituzumab govitecan, and then re-evaluated for a radical cystectomy. The primary endpoint of the study was the rate of patients achieving a complete response, so that's a YPT0 and 0 response rate. And among the secondary endpoints, there were the event-free survival, the relapse-free survival, the overall survival, and safety analysis. We also presented biomarker analysis using the Decipher bladder cancer and ctDNA results. We included 37 patients in the intention to treat population in a 3-year period. Sacituzumab govitecan determined a YPT0 and 0 response rate of around 32%. So this patient, after 12 months, had an event-free survival rate of around 75%. And in patients achieving YPT0 and 0 response, there were no relapse events. We also determined that in 10 patients with a high-risk disease, after the use of neoadjuvant Sacituzumab, in case of positive ctDNA, in 8 out of 10 patients, this ctDNA became undetectable. In the biomarker analysis, we showed that, for example, the response rate was higher in patients with the infiltrated luminal subtype. And regarding the expression of TROP2, it had no prognostic value. Instead, the expression of the TROP1 gene, that is the gene encoding for TROP2, this gene had a prognostic role. I think the results shed light on the possibility to treat patients who are ineligible for or refusing cisplatin with neoadjuvant alternatives to chemotherapy, in this case represented by Sacituzumab govitecan. And maybe in the future we will also use these drugs. We are already using these drugs to test the possibility to do a bladder sparing approach.